Good morning, everyone. Aloha. Yeah. So, myself, Mohsin Ahmed, I'm basically from India. I did my PhD in Communication Sciences and Disorders, and today I'll be talking about hearing and hearing disorders. One of my professors used to say the three most important things to live are food, clothes, and communication. Okay? So humans are animals who communicate. So communication is very, very important for us. And hearing is one of the sensory organs which directly impacts our communication ability. If we cannot hear, we cannot communicate because we are not hearing someone. And if someone feels that, oh, I'm talking to him, but he's not responding, he don't want to communicate with you. So, with the time what happens is the person with hearing loss gets isolated from the group because he cannot effectively communicate. And I'll be gonna shed some light on what types of hearing losses are there, how our hearing system works, what are the disorders associated with that, and what is old age and hearing, what happens in old age which leads to hearing loss. This diagram looks very complex, but let me simplify it. This part of the ear is the one which you can see here, the pinna, external part of the ear. Most of us have a feeling that this is ear, but you know, the bigger part of the ear is far inside, what we cannot see. So this is the external part of the ear, also called as pinna. It helps in funneling the sound. So if sound is coming from the front, it helps to collect and divert it inside. You might have seen people with hearing loss doing like this. Okay? This will help to collect more sound, and that will amplify the sound. If person don't have the pinna, there's no amplification of sound, and there will be some degree of hearing loss. It's not completely deaf, but there will be some degree of hearing loss. So pinna is really helpful in hearing. So sometimes we don't know from which direction the sound is coming, so we turn our head to find out which direction the sound is coming. So the pinna will help us to identify the location of sound in space. Okay? This purple colored thing is ear canal, the tube inside here. Some of us remove wax from there to clean our ear canal, but it is not recommended to put anything in the ear canal. Yeah. I have seen patients which comes to clinic, and when we examine ear canal, sometimes there is cotton, sometimes there is paper, sometimes there are insects. So a lot of things could happen with this ear canal. Okay, and most of them have the earwax problem. There is dense black color large earwax, which will prevent the sound to enter in the canal. So that could lead to some degree of hearing loss. This part is eardrum, also called as tympanic membrane. Sound vibration traveling from outside will go to eardrum, eardrum vibrates, and then this sound will be carried forward through these bones. Okay? Till here, we call it as external part of the ear. So ear is basically divided into three parts: outer ear, middle part of the ear. This green part is called as middle part of the ear, and this blue part is the inner part of the ear. So middle part and inner part is not visible to us. Only we can see the external part of the ear, outer part. So in middle part, you can see there are three bones. These bones are very, very, very small. This bone is stapes, that is the smallest bone of our body. Okay? In some cases, this chain gets disconnected and there is some degree of hearing loss. Sound travels from outside the ear. Here is the vibrations. The tympanic membrane conducts this vibration, and then sound travels through this shell-like structure. That is cochlea. That is the inner part of the ear, and that is like most important out of these three parts. That's why it is kept so inside, safe and secure. You can see this three circle-like things that is responsible for balance. So balance and hearing are connected. So most of the patients who report hearing problem also report balance problem. or those who report balance problem may develop some hearing issues later on. So hearing and balance organs are rightly connected here in the inner part of the ear. Okay. This tube you can see is called as eustachian tube that opens from middle ear to the nasopharynx. So it is somewhere, yeah, I'll show you the picture. Okay. So when we put the eardrop, sometimes we feel the sore sensation in the throat. So that is the reason this tube carries some of it to our throat. Okay. So sometimes there is upper respiratory tract infections that could spread to ear and that could lead to middle ear infection. So this tube connecting ear and throat. Let's go forward. This is good looking pinna, landmarks, helix, antihelix, concha. This is the opening for the ear canal. There are some conditions where pinna is absent that could lead to some degree of hearing loss. Okay. As we discussed, this is outer part of the ear, this bones and this little cavity is the middle part of the ear, and this yellow section is all inner part of the ear. And these lines are auditory nerve. The nerve will carry the information from cochlea to the brain. This is healthy looking tympanic membrane. When we put the otoscope inside the ear canal and see the tympanic membrane, it is very transparent, good looking. Here you can see there is little reflection of light, and this is the bone behind tympanic membrane. There is a small bone behind the tympanic membrane. We can see the lining of it, but we cannot see more than that, beyond that. Okay? So in some cases, this tympanic membrane is ruptured, or there is a hole in the tympanic membrane, or perforation. That could lead to some degree of hearing loss. If there is a hole, there is a possibility that external bacteria or dust will go inside and may create more infection. So we recommend having surgery to treat the hole in the tympanic membrane. If we look compared to the coin, these ossicles are so small in size, very delicate, and they're doing so important function, conducting sound. Here you can see outer ear, inner part of the ear, and this tube is connecting the nasopharynx, eustachian tube. In adults, it is vertical, more vertical. In children, it is more horizontal. That's why we recommend when we feed babies, keep their head position up and legs down so that the food material will not enter the middle part of the ear. That is one of the reasons children develop most of the middle ear infections, because the food particles may enter and that leads to infection. Again, ear canal, eardrum, sound conducted from tympanic membrane to the inner part of the ear. This is the auditory nerve which carries information to the brain. Yeah, when we look inside the inner part of the ear, the cochlea, the more safely placed organ, we can see there are two types of hair cells. These yellow one, outer hair cells, and these are inner hair cells, the small one. So outer hair cells are more in number compared to inner hair cells, and they both work the function of conducting the sound. They move in response to sound, and they conduct the information to the brain. Here is the nerve, auditory nerve, which is connecting to these hair cells, and that carries information from cochlea to the brain. Damage to this outer hair cell leads to hearing loss. Sometimes people are exposed to louder sound, music, military personnel who are exposed to blasts. They get, these hair cells get damaged in those kind of instances. Okay? So if hair cells are damaged, hearing is lost, some degree or to the profound degree. So in this case, if hair cells are damaged and there is a hearing loss, this hearing loss is not reversible. This is going to be permanent hearing loss. We cannot do surgery for bringing these hair cells back. We don't have any medicine. So the alternate options available are either we can opt for hearing aid or we can opt for cochlear implants. Okay? So this is very sensitive part of the hearing where if damages happen, it is not reversible. These three rows are outer hair cells and the single row is inner hair cells. Outer hair cell, inner hair cells, both are very important for hearing. Loud sounds could damage hair cells. Now let's talk about what I do, audiologist. hearing evaluation. Okay. For each part, we have different tests to evaluate these parts. For example, to test outer ear, we have otoscopy, where we put a device inside the ear canal to see is the structures normal, is there a lot of wax, is there any foreign body in there, or eardrum is looking normal, is there any hole in the eardrum, etc. To test middle part of the ear, we have immittance test, where the person will be sitting. I'll put a probe inside the ear and give some sounds. The instrument will test automatically the health of the middle ear. You don't have to do anything. You just sit calm, relax. The instrument will do it for you. Inner part of the ear can be tested through audiometry. There are autoacoustic emissions. Some tests are automatic, where you don't have to do anything. But in some tests, you'll be listening to sounds and responding, yes, I can hear this sound. Yes, I can hear this sound. Or you'll be repeating some words. For example, I said, repeat football, repeat airplane. You have to repeat behind me. So there are some tests where you have to respond. Some tests are completely automatic. So together, these tests give us a brief idea about how your ear is functioning. Is there any problem? If there is a problem, which part of the ear is damaged? And that will further give us idea whether it can be reversible or not, whether this can be treatable or not, what options are there for treatment. Here is the healthy outer ear pinna. Here you can see the infection in the outer part of the ear. This most common infection is otitis externa. Otitis externa is an infection due to moisture, exposure to moisture. People who swim a lot get this kind of infection in the outer part of the ear. This is a very painful situation. Sometimes people who live in area where there's a lot of moisture also develop this. So moisture is not good for our ear. Okay? Try to keep it dry. So otoscope is a lens and there is a light inside. We put this device inside the ear canal to see the health of the ear canal and the middle part of the ear, the tympanic membrane, how does it look. Okay? This is healthy tympanic membrane. Again, the outer part, middle part and inner part of the ear. Yeah. This is the middle ear testing device. We put this device in there, press the button, and this device will tell whether your middle part of the ear is working fine or not. Is there a problem? It is so simple and straight. These are various types of graphs we get from that test, which indicates which part is not working, whether the middle part of the ear is healthy, is tympanic membrane vibrating the way it should be, or there is problem with eustachian tube, the pressure balancing tube which is connecting ear and the throat, and is there a lot of wax in the ear canal, or there is infection in the middle ear. So this graphs will give us a lot of information about functioning of the middle ear. This is audiometry. How many of you have gone through audiometry hearing test? Yeah. So this might be familiar to you. You might have seen this instrument. Okay? This instrument is used to test the hearing. We have option of changing loudness, frequencies, bone vibration, air conduction, speech. We test all these things to find out the level of your hearing ability, level of your communication ability, how much this hearing loss is affecting your communication in day-to-day life. So by doing audiometry, we could see what is the type of hearing loss, what is the degree of hearing loss, and what treatment can be given for that. This is setup where we do testing, like the audiologist will be sitting outside the room. The person who is going under test is inside the room. These are the headphones, and the person will be listening in some tones which would be soft or louder depending on the hearing loss, and then the person has to respond as, I can hear this, yes, I can hear this, yes, no, I cannot hear this. Okay? So we identify at what level person can hear, and then that will help us for further referral, recommendations, or treatment. What are the types of hearing loss? There are primarily 3 types of hearing losses. First is conductive hearing loss. This hearing loss could be due to damage to the outer part of the ear or middle part of the ear. In most cases, this hearing loss is reversible. We can treat it with the medicine, we can do surgery and bring the hearing back. If there is a conductive hearing loss, we can go take medicines, do surgery, the hearing would be back, most of the cases. But in sensory neural hearing loss, this is kind of permanent hearing loss. This cannot be reversed. Aging and hearing loss. The sensory neural type of hearing loss is the most common one in aging. Okay? So sensory neural hearing loss is due to damage within the cochlea. It could be damage to the outer hair cells or stria vascularis or different structure inside the cochlea, the inner part of the ear, the safe one. And there is third type of hearing loss, that is mixed hearing loss. It could be due to combination of both. It could be due to outer part as well as inner part. Okay? If there is damage on the outer part of the ear as well as an inner part of the ear, that leads to mixed hearing loss. Okay? Three types: conductive, outer or middle part of the ear; sensory neural, mainly inner part of the ear; and mixed, both. Conductive is reversible, sensory neural is not reversible. In mixed, we can bring some degree of hearing loss back, but cannot be treated completely. We cannot make it complete normal hearing. This is the earwax impacted, black color. Sometimes patients come with, oh, I cannot hear, and when we see inside the canal, there is a lot of wax. So we just recommend them, go back, remove your wax, and come back for hearing test. Once they remove the wax, hearing is back. Oh, I can hear everything nice. Okay? So this is earwax. Here you can see the healthy eardrum. Here you can see the eardrum. There is a fluid behind this, the yellow color fluid. That is the infection. If there is an infection in the middle ear, that could accumulate fluid. You might have seen people who have ear discharge, fluids coming out of the ear. So what happens, this fluid will build up behind this tympanic membrane, but after some time this tympanic membrane could not take the pressure of this fluid, and then there is a rupture in the tympanic membrane, and then the fluids start coming out. Okay? So before the rupture, the tympanic membrane would look like this, and after some time the fluid will start coming out. So in conductive hearing losses, generally the air conduction, sound traveling through the air is not good, or there is a hearing loss. But if sound is given through the vibration, bone vibration, it's absolutely normal. The bone vibration sound is very good, but air conduction sounds are not so good. So that is kind of hearing loss in conductive type of hearing loss. It could be due to ear infection, and this is reversible. If we treat the conductive pathology, this hearing loss can be reversed. Person can hear normally, absolutely normal. Some pictures for the hair cells. These are like good looking hair cells. Here the hair cells are damaged. You can see the 2-3 rows are absent here, most of them. So this cannot be reversed. This is like permanent hearing loss. So hearing loss with noise induced hearing loss, like exposure to a lot of noise or aging, would look like this. The hair cells will damage. Sensory neural hearing loss audiogram would look like this, where both from sound coming from air or from bone vibration, both are impaired. There is loss in both modes of presentation. So age-related sensory neural hearing loss, it is also called as presbycusis. There are many reasons for age-related hearing loss. The most common is about metabolic changes. As we get older, there are a lot of metabolic changes in the body. That could be changes in blood pressure, diabetes, kidney issues, or many more. So all these systems are connected to hearing because there is a blood supply to the ear, the cochlea. If there is any change in the blood composition, that could affect the cochlear function. Okay? So metabolic is one of the reasons that impairs our hearing. Second reason is sensory loss. As we get older, there is other senses start going down. So hearing is one of them. Okay? So there is neural functioning deteriorating with age. So we might see this loss in vision gets slowly down, same for hearing, and so on. Okay? So the neural reason is another reason. One is metabolic, second is neural. And there is some changes in the cochlea with age that is called as strial. There is one structure in the cochlea that also changes with age. So these 2-3 reasons primarily leads to hearing loss with age. So in United States, around 30% of the people between 65 and 75 years of age have hearing loss, and around 50% of the people above 75 years of age have hearing loss. By 2030, there will be 21 million people above 65 years of age will have hearing loss. So this is a big number. This is a big number. And we care for them. We have solution for them. So what are the signs and symptoms of hearing loss? The signs and symptoms primarily include, the most common one I heard is that my husband or my wife would like to hear the television very loud. They keep the volume very up. Okay? So television is the first thing I heard. Second thing I heard was telephone. They could not hear on telephone. I need to shout, literally shout on telephone so that person can hear. Okay? So these are the two most common things I heard from patients. Apart from that, there are other symptoms like they'll say we need to repeat a lot. We need to speak loudly. If someone is talking from backside, they don't understand what they're saying. These people can hear somebody's talking, but they don't understand what they're talking. You know, detection, like sound is present. I know someone is talking, but what exactly they're talking, I'm not getting it. Okay, that happens with a hearing loss, which is associated with aging. So audiogram would look like sloping. In low frequency, the hearing is absolutely normal. You can see that the 20 is the normal range. If your hearing is below 20, that means towards 0, that is good. 0 is like softest sound. 100 is loudest sound. If you can hear close to 0, 10, good. Your hearing is very good. Even 20 is good. But as you start going 30, 40, 50, there is a loss. Okay? Here you can see in low frequency, the hearing is absolutely good. It is very close to 20. But in high frequency, it is going like 70, 80. It is a significant hearing loss. So this person has absolutely normal in this, hearing is absolutely normal in low frequency. So if someone talks, he can say that someone is talking there. But there is a loss in this frequency. So the information he receives is not complete. Like 50% of the information he's getting. And that is not enough to understand speech. That's why these people will say, I can hear they're talking, but I don't understand what they're talking. Okay? So this is because of this. Half of the hearing is good, half is not good. So we are missing around 50% of the information. So which sounds come in this high frequency range? Sounds like ah, oo, z, are low frequency sounds. And sounds with high frequency are sh. These are high frequency sounds. So the people with presbycusis or hearing loss related to aging mainly have difficulty listening these sounds. These are like high frequency sounds. Pull, curl. So what is the solution? Hearing aids. We have highly advanced hearing aids available nowadays. These hearing aids are available in various colors, designs, styles. You can see, you can have as small as this hearing aid. This hearing aid, if you put inside the canal, it is absolutely invisible. Nobody can see there is a hearing aid inside. Okay? So we noticed that visibility is one of the concerns that people don't want to wear hearing aid because it looks big and people can notice there is a hearing loss. So they want to go for smallest devices. But what is the advantage of using bigger devices? In bigger devices, the buttons are bigger. Handling is more easier for old age person. Here the visibility is less, the buttons and other settings are very delicate. It might be difficult for handling. Okay? If you can handle, yes, it is a good choice. If you don't, then the bigger devices are good because it's more easy to handle. Both of them have all the latest technology available. We can program these devices using software. We try to bring the quality of sound as close to normal. So if you say, I'm finding difficulty listening television, we can do some setting. If you say, I have difficulty listening in noise, we can do some setting. You say, if I talk with a group of people, I have difficulty, we can program the hearing aid according to. So these devices are amazing, this technology is amazing, we have all the options. These devices are also available with Bluetooth devices. So if you connect your Bluetooth of mobile with the hearing aid, you can receive the call and talk like this. So the hearing aid will act like a Bluetooth. You'll start hearing in the hearing aid. Okay? If you want to use remote control with the hearing aid, you can use it. I want to increase the volume. Just increase like this. Change the program with the remote control. So these hearing aids are available with remote control. These hearing aids can have FM system. For example, I'm talking from here. If I put the microphone of the FM system here, I can speak here and the person sitting at the back can hear directly in the ear. Okay? That way, sound traveling from here till there might lose quality of sound if I talk like this. But if you are using FM system, it is as clear as this microphone is picking up the sound. Okay? So FM systems are very useful in classroom settings as well as in big auditorium, and people with hearing loss who are using hearing aid, that is one of the very useful accessories. FM system, Bluetooth devices, remote controls, so all amazing technologies available with this hearing aids. So what are the facts about hearing aid? Patients who come to us with hearing problem, they expect that when we put the hearing aid, we're putting a new ear. So we are not putting the new ear. We're trying to use your existing ear to the maximum ability, what we can do. Okay? So the hearing from hearing aid may not be as natural the way you are hearing now. It may be a little mechanical because it is a device which program the sound and then deliver it to the ear. So the sound quality may be a little bit different than what you are hearing now. Okay? Hearing aids are not like glasses. Whenever you require, for example, we use glasses when we have to read. So hearing aids are not like that. Hearing aids should be used always, maximum number of hours in a day, even if you are hearing something or not. Because hearing aids usage will help you adapting to the hearing aid, it will help to get adjusted to the hearing aid, and your brain start accepting the mechanical sound of the hearing aid. If you wear it for less number of hours, your brain will not get adjusted easily. So that's why we recommend use it as much you can use it. So that initially when we put the device, you may not like the quality of sound because it is different. But eventually, if you use it for a month and 2 months, after 2 months, drastically you will see, oh, I'm liking this sound because my brain is adjusted to that sound. I'm getting adjusted to the new sound. My brain is accepting it. Okay? Our brain wiring is continuously changing throughout our life. So that is called as brain plasticity. If you do something new to the brain, initially it will say, no, this is new, I don't want this. But later on, if you say no, you don't have choice, you have to accept it. Then you'll say, okay, I'll do that. Okay? So that is the hearing aid, that you have to use it for at least 1 and 2 months for get the brain adjusted to the new sound, and then you'll start liking it. And sometimes when there is a hearing loss degree is higher, even the hearing aid may not be that beneficial. Hearing aid will benefit, but may not be to the level where the person will be satisfied. So then we need to think about other choices, what we can make to help the person in communication. Okay? For example, if there is a lot of loss here in the high frequency, hearing aid might not be very, very useful. They will help, but not to the extent a person wants. So what are the other options to improve the communication with hearing loss? Person with hearing loss always prefer talking face to face. Why? Because they get visual cues. They can read your face, they can read your expression, they can read your lip movements. That will help them understanding what person is talking. So for a hearing impaired person, whenever you're talking with a hearing impaired person, you try to be face to face. Try to be close so that the person can see you. Try to be in a good light where everything on the face and the lip reading is visible. If you're talking from backside, they might find difficult to understand. Distance is another thing. If you're talking from long distance, there will be a problem, even with advanced hearing aids. So it's better you talk from close distance. Sentences. If you're using too long sentences, they may get lost. Okay? So try to use smaller sentences, 3 word, 4 word. break the sentences. Give the pauses between sentences. If you speak one sentence, give a little bit pause. Let them process it because they're processing the information. In one of the study, what they did, they measured the fatigue in various health conditions. They take patients with cancer, HIV, hearing aid users, and etc. etc. And they measured, it was done in school going children about hearing aid usage, and they noticed the level of fatigue, and they've identified all these big health conditions like cancer and other condition, there was less fatigue, but hearing aid users showed most fatigue because they're continuously stressing the brain to process the hearing sound. And if you're giving that information too fast, it would be exhausting for them. Okay? So it is recommended that you use small sentences with a lot of pauses, give as many cues they can get, body language, facial expression, lip movements, and be close to them and speak in short sentences. Noise, if there is noise, that is very disturbing for hearing aid users. So try to reduce the noise. There could be a lot of sources which generate noise. Air condition, fan, people talking, sitting position. If someone is sitting too close to the window, there could be air noise. When you're traveling in car, air going past by the window, that could disturb them. So that we can take care of. So what are the negative impact of hearing loss? As I mentioned at the beginning of the talk that hearing loss could affect your communication. If communication is affected, that could affect self-esteem, socialization, personality, anxiety, social dissatisfaction, it may lead to cognitive decline, loss of independence. Most of old age patients who visit our clinic, they report that I don't want to use the hearing aid, but my children are forcing me to use it. So they feel like, someone is forcing me to use it. I don't want to use it. So I'm losing my independence. So that kind of feelings come in there. So it's not just hearing, it is more than that. It's our lives. So it's our communication. Remember, 3 things important for life: food, clothes, and communication. So hearing is very important for communication. So thank you so much for listening to me. If you have any questions on hearing loss, hearing aids, please feel free to ask me.